So this is part two of our discussion about teledentistry and mobile dentistry amid the COVID crisis, but also after the COVID crisis. We're on with KARE Mobile and a couple of his partners, from Dr. Watson, a couple of his partners, and also some colleagues dental providers that have some interest in this new platform that KARE Mobile is rolling out, not only locally in the areas of the Southeast, but also in the future nationally as well. This is Dr. Darwin, the new dentist coach, and you are listening to the new dentist coach podcast, Ask Dr. Darwin. So we're going to continue with our Q&A, a continuation of the first part. This is part two, and we're fielding some questions about how to incorporate this practice modality for business owners. So Dr. Watson was, in our last episode, Dr. Watson was explaining how he put together and how he manages this type of modality, very similar to what he did in his brick and mortar practice. So go ahead, Dr. Watson.
Yeah, so what we were speaking about in the last presentation was how do you maximize profitability when you're only seeing one patient at a time? And the trade-off is by reducing costs. And so for me, at this point in my career, the idea of going into debt, $1 million, $500,000 for a practice, being stuck in one location is not appealing to me. A lot of African-American practices have a harder time to sell because of their location. Being mobile provides me the opportunity to see patients all over the city, not being stuck in one location, but still being able to sell that goodwill like I would have been able to if I had my brick and mortar practice stationary in one location. So on a daily basis, as I was speaking to previously, just like my brick and mortar practice, we have a huddle in the morning. The calls are routed through our 1-800 number. We use Dentures Ascend currently as our dental software. It's cloud-based, so I'm able to, all of my team is able to log in. We huddle, we discuss who's being seen that day. We know what they're already scheduled for in advance, so we have a projected productivity. Because we have a 93% show rate when we're doing mobile services, that productivity is pretty much set. So therefore I can adjust. If that day is not booked enough, maybe we need to reschedule that day or consolidate it or find somebody else to add to that schedule to make it more optimal. But because it's only a one doctor, one assistant level, I have less overhead than the conventional practice does. And although you incorporate driving time, we plan out our day to where ideally I don't want to drive more than 12 minutes to 15 minutes between appointments. We have other things that we've learned over the last 2 years that once we have an agreement together and we're part of your consulting team, we'll teach you on how to maximize your day. We're creating scheduling software that will actually automate the scheduling process for you, so you don't have to pay somebody to try to figure out what's the optimum route, taking into consideration traffic, time of day, all of those parameters that we've already had to learn by trial and error. And so when you look at your average daily production, the way I look at things is if I have a 50% margin on this business, how much are you trying to make a day? If you as a provider are trying to make $700 a day or $800 a day, you have to do $1,600 a day worth of production that day to meet that goal. $1,600 is not that hard to attain. If you go to 6-7 houses, your average production per house is $200 to $300. 6 houses, $300 per house is $1,800 of production. It's feasible, but people didn't think about it.
Gotcha. We're going to continue with the questions. If we have some more, Dr. Cook, Dr. Williams.
I do have a couple more questions. Thank you very much, Dr. Watson. And I'm a visual person, so I'm visualizing in my mind all the different pieces. So my next question is regarding records or x-rays or treatment planning, I guess the capability inside the mobile vehicle, are you looking at, are you using something at a server that uploads the patient information? And like if you already have completed MEX on them and you need to refer back to the image with the middle of the procedure, can you talk to me a little bit about the nuances when you're seeing patients from a record standpoint, x-rays, how to access them, and
Our sensors plug right into our laptop, and Dentrix Ascend is basically Dentrix. It's just a cloud-based version. So my treatment planner, who may not be on the van with me, can actually see in real time all the images that come up. We take all our images right there on the van. The entire chart, we're paperless. So as I mentioned in the presentation, the patient registers through the application. So their health history, their dental history, all their paper, their license, all those items are collected through the application, and you will receive a secure PDF of those images that you can upload into that patient's actual chart. You chart as normal, like you would in your office. I mean, it's basically Dentrix, but the cloud version. So we have probably about 15 different licenses for it, so that my call center help has a license so they can access it at any time in real time. I can see on the van in real time if they're adding a patient to my route. My revenue cycle management team is able to access it to call on claims. Dentrix Ascend does not charge us extra for electronic records as from a standpoint of claim submission. So we pay a third party to help do that process, because what I want to do is make sure that right now I have not laid off anybody from my company with COVID-19. How many other dentists out there can say that they've not laid off any staff during this period of time?
And why is that, Doc? Why is that?
Because in Kentucky, they've eliminated the ability for us to do cleanings and some elective procedures, but everyone else is closed. We're seeing about 6 emergency patients a day. We're starting root canals, I'm doing wisdom teeth extractions, doing all those services on the van. And so me and that one assistant are still just as busy as we were prior to this pandemic. And so, and it goes back to the point that I made in the original presentation. Why did I start this? I started this because since I've graduated, every 9 years there's something. And for our age group, how do you get ahead when every 9 years something happens that brings you back to the beginning?
Zero, right?
Exactly.
Almost, right.
And so for me, when I talked about that return on investment, I want to make sure that I'm maximizing my dollars, because it matters now. And with the help of DentalWell and the team behind us, once I created that relationship, I'm saving 30% on my supply costs. I don't have the same amount of waste that I had before, because I'm doing my own fillings. I don't have people squeezing out half of the bottle of Bond when they're doing the filling for me. I'm doing those restorations. I don't have a hygienist. Now in Kentucky, I can send my hygienist out under general supervision to do all of my hygiene work once I've done the comp exam. So I send her out by herself.
On the van?
Yes. So all my recur is being taken care of right on the van as well. If I don't know what that individual needs to be done, Brent Herman from Mouthwatch is a friend of mine. He's the CEO. We utilize his product. You wanted to talk about TeleDentistry. We've been doing TeleDentistry for a year and a half. Everyone's just now getting to it. We've been doing it. We scout our patients. So if I don't, Dr. Cook, if I don't know what that patient needs to have done, I can send an assistant, which I was very a part of making sure that assistants can go out on the van and put the intraoral camera inside that patient's mouth. I can FaceTime with them remotely. I can be seeing a patient across town, FaceTime with them and see inside their mouth, diagnose what their needs are, so that when I go, I already know what that productivity is. It's not a guessing game. And I want to make sure they have the money, right? We have financing arrangements. We do everything just like a brick and mortar practice, except for we're on wheels.
And for those of you that are listening, one thing that I need to state is that you have to check your state board regulations regarding scope of practice for hygienists, for dentists, of course, but also the use and implementation of teledentistry. Every state is different. Every state is different. So what Dr. Watson is able to do in Kentucky, you may be able to do in Illinois, but you may not be able to do in Georgia. So it always depends on what the state regulations are for your state. So you need to look into that as well. I just wanted to point that out. And this is not a promotion of mouthwash. No, mouthwatch. But it's so funny you brought that up, Dr. Watson. I just did some research on them and what they're doing as far as providing that software and that camera, intraoral camera for teledentistry. Right now, I know it's not integrated. It's not integrated into. There's not a platform where they can integrate it into the current software, dental software that you have. But from what I understand, they're still working towards that. It's coming. And for those of you that want to find out some more information about it, again, it's not a promotion. I'm not endorsing it. I'm just sharing some information. Right down here, mouthwatch.com, mouthwatch.com. They have a platform called TeleDent, or I think that's the name of the company, TeleDent.
Yeah.
Great information. They have an informational video that's really, really good. Dr. Cook, I think I might have sent that to you yesterday. But again, just to get more information about how you can be prepared for this transition that has already occurred, that may continue all through 2020.
Yeah.
It may continue, or it's going to force us as practitioners to come up with new approaches, new innovative approaches to continue to practice, but also to take care of our patients, especially with not knowing how things are going to continue throughout the year. So I just wanted to add that and share that with everyone as well. Dr. Cook, I know you got some more questions, or Dr. Watson,
I want to say something to Dr. Cook real quick too. She mentioned she had 2 practices with, I think, 3 associates. Even when we return back to whatever the normal will be after this, a concern is going to be, are all of my associates busy every day? When you're part of the KARE brand and team, it's not about KARE. KARE is going to be similar to Heartland, where you don't know, Heartland owns 1,000 practices. KARE does not have to be what's marketed. What needs to be marketed on that band is the name of your practice and your business, because when you go out there, that's a moving billboard for you. Every time I go to the gas station, I get another patient. You know, we'll teach you as part of our team how we market. Now, through DentalWell, they're like, you need to get a landing page, which we have now. And we've done we're doing search engine optimization, doing some different marketing techniques. But previously, I spent no money on marketing. My patients promoted me. All these things we can show you if you're part of our brand on how we have been able to do it, how we've been able to see 120 plus patients per month on this band without spending any money to acquire these individuals. Not bad.
No, not bad at all. And I just thought of something, even with a brick and mortar practice, this can be an extension of that practice.
It is. And so it allows you to go to areas of town where my primary practice was in the hood in the west end of Louisville. Some patients didn't feel comfortable coming to where my practice used to be. Now this will allow me to put an associate, or I could have went out on my mobile unit and saw patients in areas that were not willing to come to me previously because of where my practice was located. When you talked about transitioning your practice, there's only so many ways that you can increase revenue for your practice. You either raise your prices, raise your amount of time that you see patients, increase the number of days that you see patients. That's it. And if you've totally built out your practice, there's no more opportunities that you can add to that building. This is a way to increase revenue for your brick and mortar practice at a lesser price point with a higher return on that investment.
Let's continue. That's some good information. Let's continue.
Good morning. Hi, my name is Dr. Farrah Williams. I hope I haven't cut anyone off because it's coming a little bit choppy. I am currently an owner of an affordable dentures and implant practice in Pennsylvania. And like Kentucky, we have pretty liberal, I guess, guidelines as it pertains to teledentistry. They don't call us Pennsylvania for nothing. So I'm going to say that. My practice currently is very, very limited to about 4 procedures. I do examinations, both regular and emergency. I make dentures, I do implants, and I do extractions. Do you think that this modality would work for something like that? My thought was that I do have a brick and mortar. However, there are patients that are immobile that perhaps I could maybe have a van like this and maybe go to a nursing home and set up to make dentures, to do extractions, and things like that.
We do all of those services on our van. When you saw the video of us going to someone's home, that's only one aspect of what we do. We have our memorandum of understanding with Jefferson County Public School System to where we'll be able to go into the schools. We have created partnerships with different corporations like Papa John's headquarters, where we go to their headquarters and provide services for their employees right there in their parking lot. We have delivered dentures at bedside in patients' nursing homes before. The key, though, about our brand that differentiates us from others is that we don't do one single thing. And so, you know, some of our competitors at this particular time, because there's other outfits out there that are doing mobile dentistry, none that are doing comprehensive door side like we are, but provide mobile and portable dental services. They're shut down because if your only business is going to nursing homes, you can't get into nursing homes right now.
Mm-hmm.
If your only business is going to the schools, you're shut down. You can't go to the schools right now. And so through our model where we don't pigeonhole ourselves into one niche, it provides us the versatility that we need to be effective and still be able to stay in business when economically you don't know what tomorrow is going to bring.
And that's a good point about being able to be flexible, having an extension, and being able to still serve another subset of the population that right now is really one of the most vulnerable, and that's those people that are living in assisted living homes. And you'll be surprised, there's a lot of them that are not receiving basic oral hygiene instruction. Many of them have dentures that, you know, may need to be adjusted, or just looking at their tissues. It's just a lot for those patients, those people that are living there, that I think most of us think, oh, well, they should be okay, or they, you know, they've got care through the nursing unit within those homes. But you'll be surprised, many of them have not had an oral exam or just a prophy for those teeth that they do have remaining. And it's almost kind of like a neglecting situation for them. And this is a great opportunity, like you mentioned, Dr. Williams, and also Dr. Watson, about having a letter of understanding or a letter of agreement to go into those homes and just provide basic preventative and maintenance for a large segment of the population that are there. And that is also a way of not only giving back, but also being able to really serve the underserved, or those that are most vulnerable, that just can't get to your brick and mortar practice. So something else to think about and being able to utilize this type of platform for.
And so when we speak to this, there's a group of individuals that have been doing this for years and years. One in particular I'm going to mention is Sonia Dunbar and her husband, Gerald, the geriatric tooth fairy. She actually, her and Melissa were the people that started the National Mobile Dental Conference that I was had the privilege of speaking a month or so at. The hygienist docs are doing some amazing things out here in the space, and we need to look to them as well. I probably had about half dozen hygienists that came up to me after the conference that want to own their own practice. Another way, doctors, that we can make money is by, instead of just employing these hygienists, where all the debt service, all the headaches falls on you, you could partner with hygienists. I have a hygienist right now in Michigan that wants to own her own dental practice, looking for a doctor. Now, this person is hungry. She's willing to pay for her own van. She's willing to promote her own business. You could do a collaborative business with this individual, make residual revenue without spending any money. So we have to change the way we think. We need to respect the hygienist. I'm partnered with a hygienist, Deborah Carrier from Twice as Nice, that started her uniform company. There's some very creative hygienists. Dentists, we have gotten very complacent. We want our Fridays off. We don't want to work Saturdays. We expect people to come to us in a world where that's over. But then we're going to complain about why our money's not the same, because we're not willing to think outside the box and do what's necessary in a changing environment. The world's changed. When I first started practicing, the first practice I worked out of had a dip tank where I was dipping my x-rays in the developer, getting it all over my clothes, right? Things have changed. We have to change with it. We have to use everything at our disposal to remain profitable in an ever-changing world. But sometimes we want to be the laggards instead of the leaders. And I think we need to go back to leading.
I tell you.
I got a question, Dr. Hayes and Dr. Watson. If I may, I believe that there's definitely a niche. There's several niches, and as we go forward looking for the niches where we can continue to grow and fill those gaps and find profitability and modify the things that we are doing. My question now, I'm kind of shifting my focus on PPE, specifically as it relates to this virus. I know that in my private practice, we closed our office just this week. We were seeing emergency patients until a day ago because of the lack of the N95 mask and, you know, making sure we have all the aspects of the PPE. And I think that that's going to be something that all providers are going to have to plan for as we begin to go back into our practices, since we know so little about this virus, how patients are still active after vaccine or the people who have antibodies who haven't been tested. And so we know that the saliva is a place where the virus is, and there can do to decrease the viral load, like using hexadine rinses prior to. But in terms of the PPE, can we talk a little bit about what precautions we're taking to protect it?
Yeah, so, you know, I'm on a lot of different chat groups, and I've heard all the speculation of changes in how we're going to have to provide services after. I've heard things about negative air pressure, closing in all the ops. I mean, some of these things, if you have a brick and mortar practice, and if it's similar to my 8 operatory practice I used to have where it was all open, that would have killed me to have to make those type of modifications. Our band is roughly about 65 square feet enclosed. We've added air filtration system with the filter with the UV light in there to clean the air. We just added that a few weeks ago. I have N95 inserts that I've been wearing in my mask, and I wear about 2 in the insert. The clear face shield, before I even get on the band, my assistant, who's also already properly decked out with the appropriate PPE, has already taken that individual's temperature. We have pulse oximeters if we feel like we need to check their respirations. We have UV wands to add another layer of protection and cleaning and making sure all the surfaces are disinfected. And our whole unit, if you saw the images of it, all the surfaces are able to be wiped down. And so our level of cleanliness are a little bit better than a conventional practice. And once again, we're not trying to see 16, 20 patients a day. We might see 6 or 8. So we're able to take that extra time to make sure that we're truly making sure that the van has been properly disinfected between patients, that we have on all the appropriate PPE that, you know, as the laws change, we're trying to adapt to it. And that we're just doing everything in our power to provide safety for not only the patients, but for us. But I can say, you know, I've talked to a lot of providers, like, I refuse to see anybody during this period of time. And you and I, Doc, we've been doing this for a long time, to where I'm sure you remember how scared everybody else was with the AIDS patients when they first came out. The same level of fear they had then, you see now. So all we can do as a provider is protect ourselves. I was always taught you treat everybody like they have it, even
Right.
before now. And so we still take that into consideration, but we just added a few more things to make sure that we're taking into consideration that it is an airborne disease, you know. And when I get home, you know, it's stripped down, everything goes right in the wash, and you take a shower. I'm taking all the vitamin C and elderberry and everything else to keep my immune system high, right? But I also feel like it's my job, it's what I was trained to do, to help people that giving them just an antibiotic is not helping. I have patients that they've already been on courses of antibiotics and it's not helping. And so to be on quarantine and then not to be able to get the service that you need to have done, I don't think it's a disservice to the people. And so I'm taking the risk, but I'm doing it smart. That's all I can say.
Thank you.
Good point. Good point. Dr. Williams, any other questions? Dr. Cook, any other questions?
Well, it's, you know, I can attest to the fact that it was very difficult for me to get rid of my initial practice. And in doing so, I had to take some unconventional measures. What I had to do was to sell my charts first, and then I sold my equipment individually. But even after I did that, I have a significant amount of equipment left to include a full Dentrix program. I'm completely excited about what I'm hearing right now. And my interest in this mobile dentistry thing is truly ramped up. And the fact that I still have an existing entity in a practice that I have actually closed the brick and mortar doors, but the corporation still stands. I am truly going to speak to you offline about the possibility of resurrecting this company with a completely different scope of services. And, you know, I really feel bad for the community because I probably was one of very few Medicaid providers, and leaving was really, really difficult for me, but I had no choice. When would be the best time to talk to you about the possibility of trying to, I guess, switch gears and make A+ Smile Center a mobile dentistry type of a practice?
Let's talk Monday. I would like to set up a call with yourself and Scott Mortier from DentalWell, as well as my COO, Brittany Becker, because she has done a lot of the credentialing aspects of the business. We're fully credentialed with all insurances, including Medicaid. On our van, we have several different payment options and payment arrangements for those that don't have insurance. We have a discount plan that we can discuss. We figured this thing out. You know, so we can save you time. So people are like, well, why do I need to work with you when I can just go get my own van? You could, but we built our first van ourselves. So there's things about that we know. In the second van, we were the ones that told the person that built it how to build it. And even through that, we were going to make modifications to our future models. It's all about collaboration. And I try to surround myself with people that know things that I don't, so that we can save you time and money, so that when you roll it out, you A, don't spend as much money as I had to at first, and B, it's just a quicker success because we've already done it. One thing that Darwin, Dr. Hayes had mentioned previously was knowing the laws. I have affiliation and relationships with DICOMA. DICOMA is the largest dental legal team in the country. They represent Smile Direct Club. Those are lawyers that we utilize as well, to know what the nuances are from different laws. I've done the time and surrounded myself with people that know more than myself, so we can provide you with a model that's going to be very successful in your prospective area, and that we can make money together. And I want to talk about how we start off as collaborators, but we at some point come together as partners from the standpoint of being able to scale, because this economy is about scaling. This economy is about collaboration. This economy is about figuring out a way to create systems that are replicable so that we can exit together in a fashion that will be a greater multiple than you would be able to do it as individual.
And I was going to say exit and transition. I mean, this may add more value to your businesses, being the fact that you have additional products or a different modality to deliver your products and your services as well. So that's another thing to consider.
My cell phone number is 502-523-2347. Prefer text, not call. And my email address is kwane@kare.mobi. With any questions that you may have, you can reach out at any time.
And I think we have time for one more question. I think Dr. Cook mentioned that she had something too. Go ahead, Doc.
So I'm thinking now more like on the lines of the malpractice. I mean, we do a lot of things to prepare to see patients. You add this as a part of an extension of your practice. How does the malpractice piece work? Is it because it's a part of your practice that you're covered everywhere, or are there additional aspects of it?
Depends on who your carrier is. Some carriers do not cover mobile services. So that's an offline conversation we can have to see who your current carrier. Really, it's just a phone call for you to your carrier. Hey, I'm looking at doing a mobile dental unit. Are these services covered under my conventional policy? Some policies do, some do not. And depending on which one you have, you may have to get a supplemental policy. But all of my services are covered, just like if it would have been done in a brick and mortar practice. And then, of course, you have your normal liability coverage for the van, like you would for your practice if somebody tripped on your stairs or something.
Like the business owners and the workman's comp and those policies still will be applicable.
Yeah.
Okay.
Now, since you have a brick and mortar, you're even at a greater advantage, because a lot of those policies you might have to just add this the van under that. Right? And it wouldn't have to be a separate policy. I don't own a brick and mortar practice. I have affiliation with people that own them, but I don't own one myself anymore. So all these things are extra expenses where your overhead should be even less, because you would be maximizing the staff that you already have by utilizing them. We all have that staff member that will hide, right? And if you have a big practice, it's hard to keep up with where everybody is. You want to maximize your staff. I looked at this for people that own their own practices as a way that in the morning or days in advance, if you see that the projected productivity of your practice is not where it should be, that associate could be making additional revenue for you by going out and seeing a few patients. Consolidate their day and have them go out in the afternoon and make more for your practice if you can't get more people to come to you. I say all the time, Louisville has 1.2 million people. If I can't find 10 people a day or 8 people a day that want my services, I'm not doing something right when you have 1.2 million potential customers.
That's a good point and a good segue for us to wrap up. I want to thank you guys for sharing this information. If those of you that are listening and watching, if you have some more questions about this modality with KARE Mobile, please shoot me an email right down here below at newdentistcoach@gmail.com, newdentistcoach@gmail.com. I will get your information and your question over to Dr. Watson, and you guys can talk a little bit more about this modality and how it can help you, or how you're trying to figure out how it can help you in your business and also the community that you're serving. Dr. Watson, Dr. Cook, Dr. Williams, Brittany, and Scott, thank you all for joining in on this webinar about teledentistry and more during and after COVID. I think it's been an enlightening, informational session, and we'll do some more of this in the future. So thank you all.
Thank you, bro.
Yeah,
Thank you. Thank you.
You're welcome. You're welcome. You guys that are watching, check out this next video right here. You can check it out here, and be sure that you subscribe to the YouTube page, Dr. Darwin Speaks, and we're also on on several audio podcasts as well on iTunes. And so check us out there and subscribe. Thanks so much. Share this video, and we'll see you on the next video. Peace.